Should microultrasonography be considered for image-guided prostate biopsy? Are patients at risk for another stroke after having a TIA? Would a proposed $2 drug list for Medicare Part D result in out-of-pocket savings? This and more on this episode of JAMA Editor Summary. Hello, and welcome to our listeners around the world. Today is Friday, March 28th, 2025. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. I'm joined today by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Kirsten. First up, there's a research article by Dr. Kinnaird and colleagues about diagnosing prostate cancer with a new method, Microultrasonography-Guided biopsy. In this trial, patients with a clinical suspicion for prostate cancer were randomly assigned to biopsy by one of three methods: Microultrasonography-Guided technique, microultrasonography with MRI fusion-guided approach, or MRI with conventional ultrasound fusion-guided approach. The authors conclude that microultrasonography-guided biopsy was non-inferior to MRI with conventional ultrasonography fusion-guided biopsy. These findings apply to Gleason grade group 2 or higher prostate cancer among men who had not previously undergone biopsy.
JAMA also published a systematic review and meta-analysis about the long-term risk of subsequent stroke after having a transient ischemic attack, or TIA, or minor stroke. The PERSIST collaborators evaluated data that included over 100,000 individuals. They found that there is a persistently high risk of subsequent stroke at 1, 5, and 10 years for patients who have had a TIA or minor stroke.
Dr. Hernandez and colleagues contributed a research letter this week about generic drug costs for Medicare Part D beneficiaries. If the Medicare $2 drug list model had been in place in 2021, the authors estimate that beneficiaries would have experienced a 63% reduction in out-of-pocket spending.
There's a great set of viewpoints this week, Preeti. Dr. Misicus and colleagues wrote a viewpoint about sodium reduction efforts in the United States. They discussed the Food and Drug Administration's multi-phase plan, descriptions of other sodium reduction initiatives, and suggestions for the FDA's Phase 2 evaluation. In another JAMA viewpoint, Dr. Mueller and colleagues wrote about the End Kidney Deaths Act. They described the new proposal, which would provide refundable tax credits to living kidney donors who donate kidneys to strangers, and they caution about potentially harmful irreversible repercussions for organ donation. Ballistics testing, shown in a JAMA video this week, demonstrates the effects of bullet size, mass, and velocity in a simulated laboratory setting. This simulated testing has the potential to improve our understanding of gunshot wounds.
JAMA's clinical content features an insights article by Dr. Liu and colleagues about peripheral nerve blocks for hip fractures. They explained the benefits and technique for this procedure and also demonstrated it in an accompanying JAMA video. This week, the JAMA clinical review is about autosomal dominant polycystic kidney disease. Dr. Shabib and colleagues summarized the pathophysiology and management of this genetic kidney disease. Here's a clip of that discussion on the related JAMA Clinical Reviews podcast.
Polycystic kidney disease is an umbrella term that we use when we're thinking about kidneys in which there are bilateral and multiple renal cysts. And in general, for polycystic kidney disease, the kidneys are enlarged. And that disease is caused primarily by two genes, PKD1 or PKD2, with PKD1 being the more common. And PKD1 and PKD2 encode for proteins called polycystin-1 and polycystin-2. And these proteins interact with each other in an organelle that we think is particularly important called the primary cilium. This protein complex sits on the primary cilium and senses what's in the environment around the cell. So it's sensing flow or changes in concentration or changes in the speed of things passing by this primary cilium. So any place where we expect to see this normal functioning and the functioning is gone, we can see an impact in PKD.
Ovarian aging and fertility is the topic of JAMA's patient page, which includes information about in vitro fertilization and oocyte cryopreservation.
Let's talk about the JAMA Medical News article by news intern Nora Collins. She reports on an interview between JAMA Plus AI Editor-in-Chief, Dr. Perlis, and Dr. Herman from the University of Pennsylvania. Dr. Herman discusses his team's work creating race-agnostic prenatal screening for open neural tube defects. Here's a clip from the interview on the related JAMA Plus AI Conversations podcast.
One of the things I should point out here is this is a podcast about AI. A lot of times we're talking about new AI applications, but I'm wondering, this is a fairly straightforward question that you're trying to address about race and the role of race in models. But since this is an AI podcast, do you think there's something to take away from this for people who are building these really complicated AI models and have a choice of either incorporating race or not incorporating race in what they're doing?
Yeah, it's a great question. I mean, zooming out from here, our particular question here focused on prenatal screening. It's different from that general case in that the model is very, very small. It's transparent, and we can understand explicitly the difference between including race or not including race. One of the takeaways, I think, is it's really important to have good outcome measures. And if you think more broadly, being able to assess for a particular application of AI, for a particular clinical question, how it affects different groups of patients for process and clinical outcomes that we think are most important for that. And it's important to do that at the time that you're developing. It's also really important for us to develop tools that would allow us to do this practically in practice, to monitor and to say, well, if I brought this tool into practice, did it change the frequency of this important clinical outcome across patients?
Freelance journalist Linda Rogers shares information about updated recommendations on acute coronary syndromes from the American College of Cardiology and the American Heart Association.
Wonderful, Preeti. JAMA covered a wide range of impactful clinical content this week. Thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Daniel Morrow, Shelley Steffens, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.